Welcome to AHEC Scholars. We're so excited to have you join and start investing in the future of healthcare in underserved communities. While AHEC Scholars is a national program with tremendous reach and benefits to each student and area that it serves, the way states and centers implement their program depends on the needs of the demographic they serve. So, let's look at some of the larger details of the AHEC Scholars program. This is a 2-year program with interprofessional curriculum to implement a defined set of topics through clinical, didactic, and community-based activities. To be eligible, students must have a current interest in rural or underserved urban healthcare, be currently enrolled in a health profession degree or certificate program, and be 2 years from completion of those programs. The AHEC Scholars core topic areas include interprofessional education, social determinants of health, cultural competency, practice transformation, behavioral and oral health integration, and current and emerging health issues. The AHEC Scholars program provides students with interprofessional learning opportunities focused on building skills and competencies needed to help transform primary care and improve patient care, especially in underserved settings. Each year of the program includes 40 hours of community-based experiential or clinical training and 40 hours of didactic, usually online, education. Didactic curriculum focuses on the 6 core topics transforming healthcare. Instruction is often self-paced and takes place online via lectures, modules, readings, videos, and other settings. Curriculum classrooms vary per AHEC. Some use Canvas, Blackboard, Google Classroom, and many more, whichever works best in your area. In addition, each AHEC individually determines if synchronous or asynchronous work is best for their program. Experiential training is the process of team-based interprofessional instruction in health profession shortage areas that include a component of direct work experience. These can be internships, practicum, clinical practice-based experiences, or interactive learning events or simulations covering any of the core topic areas. Reporting the didactic and experiential hours can be done in many ways. Modules can provide completion certificates, attendance at synchronous events, reflections and discussion boards for asynchronous learning, and some other proof of completion like checklists, activity logs, photographs that can be shared on social media, and preceptor agreements help track program completion. Whether a center decides to enforce periodic deadlines or keep students on track using one end-of-year deadline, consistent communication is vital to keeping AHEC scholars engaged in the program. AHEC scholars work as a bridge connecting students to preceptors, professional networks, and other allied health professions and communities. Define partnerships or even well-working relationships within academic institutions, clinics, hospitals, and community agencies provide greater opportunities for students to grow their skills and become invested as a member of the community. One of the biggest benefits of being a part of the Scholars Program is being a part of the nationally recognized program where scholars are given the chance to network interprofessionally, not only with other scholars in their state, but also with other professionals inside the healthcare system. The program emphasizes an interdisciplinary, team-based approach to address the health disparities within their communities covered in the curriculum. The Scholars Program allows health professional and allied health students to engage in extracurricular training that is complementary to their academic education by gaining additional knowledge and experience in rural and/or underserved urban settings. In addition, several centers provide their scholars with nationally recognized certifications and trainings to bolster their resume and bridge the gap between the knowledge they have and the skills employers are looking for. Some examples of what other centers have offered are mental health first aid, national CLAS standards, certificate from the Institution of Healthcare Improvement, team steps from the Agency for Healthcare Research and Quality, and many more. Upon completion of the AHEC Scholars Program, participants are rewarded with a certificate from the National AHEC organization signed by both the NEO president and their local director. AHEC offers tremendous opportunities for students who are from or interested in working in rural and urban underserved settings. The program structure develops students into leaders with an exceptional understanding of the healthcare system and high-end communication skills. Participating in AHEC events helps students find mentors and build relationships with practicing professionals. Growing their professional network early in their career is vital to achieving their long-term goals. In conjunction with the student's own health professional program, AHEC scholars will enhance their clinical training with knowledge and skill level. Partnerships assist with a center's ability to recruit, so it's important to be able to convey all these benefits of the program to those facilities as well as students themselves. Current AHEC scholars are an integral part of recruiting the next cohort. Student-to-student recruitment is the most compelling way to prove the appeal of the program. Public recognition and incentives are a great way to promote through current students. Graduation cords, shirts, email badges, portfolios, backpacks create recognition and professionalism of the brand of AHEC scholars. Another major incentive item different centers acquire is providing stipends to scholars. Stipends are at a different level per center and are dependent upon funding. Scholars will also gain a social media presence, whether that is through their own center or within NAO as a whole. It is important for centers to highlight scholars who are going above and beyond. Showcasing the opportunities scholars are having and the impact they have on communities is worth showcasing. Guided by selected mentors and preceptors from the community, scholars receive team-based clinical training and learn how a clinical setting responds to the health needs of underserved or rural communities. Meaning a certain amount of clinical-based experiential learning or community experiential learning opportunities are required to be a part of the AHEC Scholars Program. Making the impact on the community is a great feature to highlight when recruiting and supplementing the education students currently learn in their classrooms. As an AHEC center, you belong to a group of other AHECs who will have the same guiding mission. Working collaboratively with your other centers maximizes your reach and access to resources. Statewide initiatives can be undertaken collectively with a more significant impact in your state and local areas. By sharing the work, larger projects are possible. Working with regional centers creates programming that may apply to your unique location. During 2020-2021, national collaborations became increasingly important. Changes in budget and restrictions due to social distancing required creativity for centers to meet our mission. National partnerships met these needs and allowed AHEC scholars to improve their understanding of the reach of AHEC as a program. Through these efforts, students participated in simulation events, panel discussions, and screenings. Being a part of the National AHEC organization allows excellent support for the development of scholars programming. Topics including topics on scholars, diversity, and pipeline events. Resources include training and networking events. Previous activities are archived on the website also. The Education Committee develops a great list of evidence-based resources for AHEC scholars and AHEC staff, which is available on the members-only resource site. Another great way to learn from each other is through individual guidance. The Mentorship Committee pairs participants with seasoned helpers to work through various needs. This one-on-one approach better allows for understanding the nuances of your particular location and position. The National Training Center also facilitates partnerships with other organizations to promote training. Current projects include HPV, lupus, maternal telehealth access, and rural telementoring training. The weekly newsletter also provides information on upcoming trainings, funding, announcements, and information pertinent to your area. The National AHEC Scholars Program not only shows students where they are and what they can do where they are, but also shows them where AHEC can take them.